Did you know that Fragile X syndrome is the most common inherited cause of autism? If you or your partner recently found out that you're a carrier of Fragile X, you might be wondering, what does this mean for your future children? What are your options for pregnancy? How can you reduce the risk of passing on Fragile X syndrome? In this video, we'll explain everything you need to know in simple terms, so you can make the best decision for your family. What is Fragile X? Fragile X syndrome is caused by a mutation in the FMR1 gene on the X chromosome. This mutation affects brain development and is linked to intellectual disabilities and autism spectrum disorder. You may have discovered that you're a carrier through a simple blood test, which is great because early knowledge gives you more options. If you found that you are a premutation carrier, there is a risk of passing a full mutation to your child. Be aware that some women with premutation experience primary ovarian insufficiency, which can cause early menopause or fertility challenges. Also, based on researches, some men with premutation can experience low sperm counts or hormonal imbalances. Because of this, they may have a shorter window for getting pregnant and should consider planning for pregnancy earlier, rather than waiting until later. So what can you do if you want to have a baby but reduce the risk of passing on Fragile X? Let's explore your options. Your first step is genetic counseling. Before making any decisions, the best thing you can do is talk to a genetic counselor. They will explain your specific risks based on your test results. They will help you understand your reproductive options, and they will guide you through the next steps based on what's right for you. Now let's look at your main options when planning for a baby. Option 1. Natural conception with prenatal testing. If you choose to conceive naturally, you can do prenatal testing to find out if your baby has the full mutation. Prenatal testing can be done with CVS or amniocentesis methods. The CVS method, or chorionic villus sampling, performed between 10 to 13 weeks of pregnancy, uses a small sample of placental tissue to check for Fragile X. The other method, named amniocentesis, done between 15 to 20 weeks, tests a sample of amniotic fluid. See if the baby has inherited the mutation. If your baby has the full mutation, understanding this important information gives you the opportunity to make informed decisions that can positively impact both your child's life and your own. This option is best for couples who are open to natural conception but want to be prepared for any outcome. Option 2. In vitro fertilization, IVF, with preimplantation genetic testing, PGTM. For those who want to eliminate the risk of passing Fragile X, IVF with PGTM is a great option. IVF allows doctors to create embryos in a lab. After that, each embryo is tested for Fragile X before implantation, and only embryos without the mutation are transferred to the uterus. This option ensures your child will not inherit Fragile X syndrome. If you have fragile eggs or low ovarian reserve, you may need additional fertility treatments to retrieve healthy eggs. Option 3. Reproductive cell donation. Advanced reproductive support enables families to grow through donated genetic cells, offering hope to those facing challenges. Option 4. Adoption. For some couples, adoption is the best choice. It allows you to grow your family without genetic risks. There are many children in need of loving homes, and adoption provides a meaningful way to build a family. If you're a Fragile X carrier, it's important to also think about your own health, not just the risks for your children. Being a carrier can come with its own challenges, including potential health conditions that may develop over time. In our next video, we'll explore the risks for people with a premutation of Fragile X, including how it can affect your health and what you can do to manage it. Don't forget to like, subscribe, and turn on notifications so you don't miss it. Thanks for watching, and see you next time.